Welcome back to Diabetic Foot Files. I'm Dr. G. This episode is pretty much I had a patient that would tell me how hard it was for them to find a new doctor because their other doctor wasn't in their plan anymore, in their insurance plan. And that happens quite often. And that also causes a huge delay in their treatment and care of their diabetic foot ulcer or, whatever is going on with the lower extremity. And I don't want that to happen. So I realized we never dealt with that. So this episode is for anyone who has to change doctors because of insurance or if they have to move, if their network changes, that happens as well, or their provider is leaving their plan. So we're going to cover what to do immediately when you learn that you must switch, how to pick a good doctor, not just an available one, right? But sometimes that happens how to get your records fast and correctly, what to do if you have an emergency and you're afraid your insurance won't cover it, and what the research says about continuity of care and insurance switching. Okay, so let's get into it. So, why is switching doctors feel so dangerous for the patient? Okay. So, the research in plain English says continuity of care. I'm a big firm believer in continuity of care, seeing the same doctor over time. Okay. Is associated with lower mortality rates and better outcomes in a large observational study and a systematic review. But when people switch insurances, studies show increase in new physician visits and short-term bump in ED so emergency department use, especially in public insurance populations. So when this relationship gets disrupted, like a provider turnover or a network exits, the outcome and the utilization can shift because people miss follow ups. There's delay in care and they have to restart the story from scratch. So, in translation, continuity of care matters because your doctor stops being a stranger. They get to know you, they know your allergy, everything like that. They learn your baseline, they know your red flags, they know your this is normal for me versus this is not normal for me, and that's what matters a lot. So, what is your 48-hour plan when it comes to your insurance forcing you to switch? So, first you should do call your insurance and ask these 5 questions. So, I would get a notebook or pad or just pause it and write it down one by one, okay? But you can use this script. Hi, I need help because my physician is no longer in network. So, I want to first question I need a current in-network provider list for primary care, endocrinology, podiatry, wound care, vascular, whichever specialty you need. Second question, whether I qualify for continuity of care or transition of care coverage to keep seeing my doctor temporarily. 3, what documentation you need, such as diagnosis, active treatment plan, surgery schedule, wound care plan, how to file it, and the deadline for the filing it. And then fifth question is whether I need a new referral or a prior authorization for my ongoing care. So I hope everybody took those questions down. So why does this matter? Many plans have a continuity of care slash transition of care process, especially when you are in an active course of treatment. Rules can vary by the plan type. Medicare Advantage has a specific continuity slash transition expectations, including transition window for active treatment. So, what's the next step? You need to ask your current physician's office for what we call bridge support. So, you ask for refills to cover you until the first appointment with your new doctor. Okay. Like the ones that you actually need. I'm not talking about opioids or anything like that because that's something that needs to be covered. I I'm just gonna say like I always say, I like pain management to cover the opioids. Okay. Next, a brief medical summary. So, problem list, your meds, your allergies, your most recent hemoglobin A1C, because that's like the most first thing I usually ask patients. Vascular status, your wound history. You need medical documentation of that. Then you need a printed copy or a portal copy of your last 2 to 3 key notes from your specialist. Okay, so whether it's the endocrinologist, whether it's the wound care specialist, whether it's the vascular, whether it's podiatry, you need that. Next, book your next doctor now. Then you optimize later, okay? So get on the schedule, even if it's 6 to 8 weeks out, because I know it takes hard when it's, especially if it's a really good doctor or they're in a good network or something like that, they are booked out very quickly and they have a specific schedule for new patients. They usually need longer time for new patients for a full evaluation. So sometimes they are scheduled out weeks out, like 4 weeks, 3 weeks, 6 weeks, sometimes even 8 weeks. Okay. But then you can still keep searching during that time for something sooner. Okay. I always tell patients that I I used to call and see if they had any cancellation so they can get to know me, especially if there was a particular specialist that I really wanted to see. So, how to pick a good physician? I mean, to each his own. Everybody knows what they want or what they need from their physician, okay? But pretty much you're picking your team leader for that particular area of your health, okay? So that person is pretty much the team leader. You're you're doing your draft. Remember we did the wound draft? So, what are the 5 green flags checklist for how to pick a good physician? You want somebody who can explain and confirm that you understand it, somebody who welcomes questions and involves you in the decision making of your patient centered care. Next is somebody who documents clearly and uses portal and then accessible communication, and then someone who coordinates well, like good referrals, wound care clinic referrals, vascular referrals, endocrinology referrals, and that also that they follow up and be like, "Oh, did you follow up with the vascular doctor? Did you, you know?" Because honestly, sometimes we are able to contact that physician or that physician clinic, especially if it's emergent, to get you in sooner. And hopefully we're in good standing with that physician or that they are able to make a favor or try to get us the patient in for us as soon as possible, especially if it's in case of emergency, emergent situation. And also you need a doctor that respects your goals. So like I say, autonomy, I've had quite a few patients tell me that they, like I said, they feel bullied, that they got bullied into doing amputations. And so we have to know your goals. So, and you want your doctor to respect your goals. So, if your goals is to keep you walking, because that can be different for two different people. If they need an amputation but also need a prosthetic, or if they want to keep all their toes, okay? They want to avoid amputation, or if they want pain control, or if they want to control their hemoglobin A1C. We have to have a doctor that respects your goals, okay? Next, red flags. What are red flags? Somebody who says, I I wanna be like that lady who said, "Ain't nobody got time for that." But somebody who says they don't have time for that, okay? Especially if you're trying to explain something, if you're trying to get them to understand. I love when patients have another question about something else that is going on with their foot, even if it's like the contralateral, like, "Well, something else came up," or whatever, and I love that because it kinda shows me, in my opinion, that they're comfortable enough to know that, yeah, my doctor can take care of me. I want them to make sure that check the other side, or I'm concerned about something else, and they know that I can hear them out no matter what. Even if we're short for time, I'm going to hear that patient out. I'm very I think kinda I knew I was kinda known for that, especially in my previous clinics for taking so long with patients because I try to explain things with patients. If they have as much questions as they like, because I want them to leave that appointment understanding everything, knowing that I care about them and I care about their goals, and I always apologize if I'm late to for the next patient, like, next door if the patient is taking my extra time. I respect everybody's time, but I do wanna make sure everybody understands and that I respect their patient's goals and that we come to a consensus. Next, what are the red another red flag? No clear follow-up plan. So let's say you have a diabetic foot ulcer and they're like, "Oh, just follow up in 2 weeks," don't give you any antibiotics, things like that. somebody who refuses to share your records, these are your records or summaries. I don't understand why they would do that. That's your records. It's about you. You usually have to sign, what is it? Not a discharge. I keep on forgetting the actual word, but it's a specific form to get your medical records, okay? But they have a special form for that, most places. If a doctor dismiss your symptoms saying, "Oh, it's nothing," without evaluating or explaining to you why it's nothing, and then also if somebody keeps on making everything your fault, like shame-based medicine, I don't agree with that. If you feel like you're being shamed, then no, no, okay? And then where should you look? A fast and practical way. Your insurer directory. I remember when I got new insurance, I had to go through it. I'm not gonna lie, I looked at reviews, I looked at the person's credentials because also you remember it's hard to switch once you finally are in. Next, you can look at the hospital and their clinic affiliations, if they have a limb salvage program, if they have a wound care center. Ask your pharmacist which doctors send clear prescriptions and responds well, because sometimes there is a miscommunication and some doctors are hard to reach, some doctors aren't. But, a lot of doctors are very busy, so I'm not going to scold anybody for that. And then you ask your current specialist who they trust in the network. A lot of patients ask me that. They ask, "Oh, who would you recommend once you leave?" And I had a good amount of people that I did trust and would recommend, especially in residency, because mostly because of our training, because our attendings trained us so well. So I had a lot of faith in my colleagues, but when I got in the real world, yeah, I noticed that some people did care and some people didn't. So, you know, I always try to make sure that my patients get referred to or are able to, if I'm not there, next best thing. But that's also why I give patients my number because one thing I do know, they be quick to tell me what happened, and I'll be like, "Oh, really? Sincerely?" You know? Okay, next, first visit questions. Dr. G approved. So I call it the BRAN questions, okay? BRAN. So benefits, risk, alternatives, and then nothing. Like, what if we do nothing? Type of question. And that is a question you need to ask. What if we do nothing? Patients need to ask that question more often in their appointments, especially during their treatment plan explanation, okay? But ask, what are the benefits of this plan? What are the risks? What are the alternatives? What happens if we do nothing for 2 to 4 weeks, okay? Because a lot of patients will ask, they don't wanna do a debridement, say that, or they're not ready for it, but their vascular is intact, okay? But they're not ready for it. They'll be like, "What would happen if we do nothing and we just wait 2 to 4 weeks?" I make them fully aware, if you have an abscess in there, it can spread, it can go faster, or if you have osteomyelitis, although it already probes the bone, I'm just gonna be honest with you, the risk of amputation goes higher the longer you wait for any removal of the bone or treatment of the bone. We all know that, IV antibiotics is the strongest when it comes to that. So a patient who wants to delay even the hospital admission, things like that. Okay. But that is a good question to ask so that you are fully aware and you can make the right decisions for yourself. Autonomy. Okay. Knowing the risks, the benefits, and the alternatives. Now, getting your records. You have the right to access your records. If your care is in the US under HIPAA, you have the right to access your records. And that entitles you generally must respond within 30 days. Okay. These entities must respond within 30 days with limited exceptions and an allowable extension in certain circumstances. Okay. But what to request? Because I don't think you can really say everything at first. So when you request, you could say the last 2 years of your office visits or the last 10 visits, the most recent visits, your medication list, your allergies, your problems list, your labs, your imaging reports, your vascular studies, your wound measurements, and your operative reports. I mean, I'm just going to be honest, it might take a long time, but I do believe if you had a hospital admission, you should get the medical records of all your hospital stay. I do believe in people doing that. Getting your medical records of your hospital stay and having that with you because wherever you can go, you can have that, and the doctor is able to understand exactly what they did. If did they do arterial duplex? Did they do an angioplasty? Did they do a bone resection? Things like that, so we can understand exactly what was the treatment plan and where to go from here. It's very helpful. So how do you say it in exact words? So you could say, please send my records electronically to me through the portal or secure email, and also send them to Dr. So and so, who's ever clinic or fax. So HIPAA allows you to direct the records to a third party once you sign the forms. Because let's say you're switching doctors, right? Yeah, you have to sign the right forms, and actually, I think they have to also fax it too, to agree to getting your medical records sent to the new doctor's clinic. And pro tip, ask for a one-page continuity summary. So a continuity summary is like the diagnosis, your active treatment plan, your current medications, and your do not miss warnings, like things like renal disease, PAD, anticoagulations, uh, and allergy list. So, what to do in an emergency? So, if you think it's an emergency, go. Simple as that. Go to the ER, okay? Because in the US, it requires hospital emergency departments to provide a medical screening examination and stabilization treatment, regardless, I believe this is still true, regardless of insurance or the ability to pay. So insurance fear is real because I know a lot of patients are scared of that and they're like, oh, I don't want to see the bill afterwards, things like that. But for emergency services, consumer protections are built around this prudent lay person standard. So coverage is based on symptoms that would make a person reasonable think it's an emergency, not your final diagnosis. But insurance is insurance. Kind of like it's kind of different right now. It seems like a lot of people are advocating against what's going on with insurance approvals and denials and things like that. It's more political at this moment. So we'll see what the end result of that is. But hopefully, in the end result is for the best care and well-being of the patient and increase their quality of life. That's all I care about. So, diabetic foot ER symptoms where, yeah, you need to go to the ER. Fever, foot wound that is red hot swollen, things like that, or if it's draining. Rapidly spreading redness, black or gray tissue, severe pain out of proportion, new numbness, cold feet, color change, purulent drainage, foul odor, systemic symptoms, confusion, dehydration, vomiting, very high sugars. And then you should bring with you a little mini medical resume. So on your phone or your notes app, you should have your diagnosis, your already made diagnosis in the past, your medicine list, your doses, your allergies, your last hemoglobin A1C, your prior surgeries, your vascular history, and your physician's name. And so now, let's do the switch without sinking checklist because we kind of went through the whole slew and system of how to handle switching doctors if you when it comes to switching insurance plans, things like that, or even moving. So, what is number one? You call your insurance, you ask for the provider list, and ask if there is a transition or continuity request or the bridging of support. Okay. 2, you book the next doctor. 3, like we said, request the refills and get a brief summary from the current doctor office. 4, you get your requested targeted reports, not the vague reports, the targeted reports. And then 5, your first appointment, remember the brand questions, the benefits, the risks, the alternatives, and what if we do nothing questions and the clear follow-up. And then in case of emergencies, based on your symptoms, do not ever delay an emergency. And what I say, honestly, when in doubt, just go. I've never, one thing I can just bet on I have never seen somebody who had a diabetic foot ulcer, right? And was suspicious of possible neck fash, right? And they got the CT and confirmed it, right? But the fact of the matter is I have seen more people missing necrotizing fasciitis because it's so fast over people erring on the side of caution. So, I mean, I feel like so much feet and limbs can be saved by just no matter what. if you kind of think so, even if the white blood cell is normal, and I get it, but I would just get the CT. I would just get the CT, get the X-ray, get the CT, because I promise you this, it's better to rule it out and rule out neck fast than to miss it. That's one thing I do know. It is better to rule out necrotizing fasciitis than miss it. I think people are not aware of how common it is. It is quite common. Very, very popular, okay? It's not some once in a blue moon type of diagnosis. It is quite popular, and the fact of the matter is a lot of people miss it because they'll come into the ED, erythematous thing, fine, give them antibiotics, oral, a little bit of IV, and then come back. If it gets worse, they come back the next day, and it's amputation time. So and the doctor might have done the X-ray, and there was like everything looked fine on the X-ray. So, but if they had gone in a CT, they would have saw the subcutaneous emphysema, the little bubbles, okay? So, I just feel like that would be super helpful. I know I don't want to waste any medical resources of the system, but amputation is an irreversible procedure, okay? We can't put it back on the patient. So, to my knowledge. So, like I said, I've seen more people miss necrotizing fasciitis by not getting a CT because the X-ray looked normal and it didn't seem that bad compared to if people just erred on the side of caution. And I get it, but honestly, I feel like it could save a lot of lives and feet and people from amputation. That's a completely side note. Okay, so let's do a quick Q&A. So question 1, if my insurance changes, do I have to stop seeing my doctor immediately? Answer is not always. Like I said, ask about continuity slash transition of care exceptions for active treatment. Question 2, how fast can I get my records? In the US, HIPAA generally requires access within 30 days. Okay, generally. Question 3, what if I'm scared the insurance won't cover the ER? Like I said, emergency cover protections use this prudent lay person standard, and hospitals have this EMTALA obligation for screening and stabilization. So honestly, it's the best thing to do. And then question 4, what if the number one way to go to a good doctor is for chronic disease care? That's an interesting question, but you have to practice and they have to practice shared decision making and leave you with a clear plan. So, hopefully, this episode was helpful to somebody and share it if you like it, or you have somebody who just got a dreaded insurance letter saying that they have to switch or their provider left their plan. And remember, you're not starting over, okay? You're just transferring the care and you have the rights. You actually have rights and you have strategies that can make this transfer safe and effective and where we can help continue to save your life. So this is Dr. G. This is Diabetic Foot Files, where toes tell the truth and take care of your feet because they take care of you.